So we're just going to allow another 1 minute or so for people to enter the room. In the meantime, for people that are here now, there's a chat function that you can use. We'll take some questions during this webinar. We're going to go for about 50 minutes. If you want to ask questions around the protocols, please use the chat function to do so. And we'll address what we can in this webinar within the time we've got available, which is likely to be between sort of 45 and 50 minutes. And the questions we can't address in the webinar, we'll pay attention to, and we'll look to follow up after the webinar. Right, so looks like we've got the audience together, and welcome everyone to our webinar on the National Construction Protocols under COVID-19 Alert Level 3. I'm Fraser May from Civil Contractors New Zealand. I'll be your moderator today, and along with us, along with me today, we have Chris Alderson, who is the Chief Executive of Construction Health and Safety New Zealand, and we also have Stacy Goldsworthy, Civil Contractors New Zealand Technical Manager, who have both been heavily involved. If you didn't hear my earlier statement, we've got a chat function here, so feel free to ask us any questions you may have around the protocols using the chat function, and do our best to get back to you and let you know. So the other thing is there's some government guidance around contracts and things like that. So we'll send a link after the webinar with through to a little survey. So any questions that you may have, we'll be able to answer using that. Now, I'm going to hand over to Stacy Goldsworthy, who's just going to do a little bit of an introductory talk about what you'll be hearing today. Please take it away, Stacy.
Thanks for that, Fraser. I suppose thanks everybody for attending this morning. I think we had said a few weeks ago that it's okay to be in a bubble. We would have got drug tested, so how the world has changed. So a couple of 3 weeks ago, through the construction accord, we got a small group of us got tasked to look at what was available worldwide from our protocols. So there was a lot of information that was provided from clients, from our membership, from our supply chain, and all that information was pulled into one resource. And then from there, we've looked at what's good. We've looked at the World Health Organization, what they've been putting out. We've looked at the Ministry of Health and tried to pull together these protocols to pretty much reflect what is best practice out at the moment. So it's, I suppose, a good thing with the protocols that we put out on Thursday night is that it combines from the vertical and also for the horizontal. So we've reached agreement between the two areas of construction. I suppose it's I'd like to kind of thank those that have been involved in the process. I suppose, as I mentioned before, there was a small working group that was put together at the outset, and we've had a couple of people come and go from that group as we've gone through. So Joe Prigmore from Fulton Hogan, Carla Tonks from Fletcher's, Andrew Confey from SiteSafe, Adam Still from SiteSafe as well, Stuart Chapman from Hawkins, Anne-Marie Bush, who's done a lot of the administration from SiteSafe, Pete Lockhart from Nader Love, and John Saylor from Commercial Bay. And Commercial Bay building in downtown Auckland has got 2,200 people working in it. So they've got a bit of a challenge about how they get some of those people back to work. And also a large part of both our membership, Civil Contractors membership, and also the vertical guys about providing feedback as we've gone through this process. You know, it's been invaluable for us to shape the final document, well, the current document, not the final document that we have at the moment. So, so from a resource horsepower point of view, I'd like to thank SiteSafe, Brett Murray and the team over there. You know, they've provided a lot of the input, you know, a lot of the from a digital design point of view, and they've done a lot of the putting the information that's been provided into a format for everybody to review. And so as changes has come through, they've done them, and you know, it's a bit of they've done a bit of a mean effort to get what we have available. Also, Chaz Ams, Chris and the team over there, and Chris will tell us about their involvement fairly soon. So, but yeah, to get the government on board with what we're doing, you know, to get a standard across the construction industry. So when we do go to level work. It's been bloody good effort there. So probably on that note, I'll hand over to Chris just to talk around the standard and the protocols and how that works and again.
Okay. Hey, thanks, Stacy, and morning, everybody. Do you want to just flick the presentation forward, Stacy, to the page with the protocol summary on it? Great, thank you. So look, as I said, look, my name's Chris Alderson. I'm the CE at Construction Health and Safety NZ. You might not know who Construction Health and Safety NZ are. So we're basically a standard setting organisation in health and safety for construction, charitable trust set up around 2 years ago. And if you go through to our website and have a look on our board, you'll see that we're pretty much represented right across the industry. In the civil area, Steve Colleen from Downers is the board member that sort of looks after civil. So the other thing that Stacy mentioned this morning was the construction accord. So for those who don't know what the construction accord is, the construction sector accord was set up around about 6 months ago. And it was really set up to try and fix a whole lot of things we thought was systemically a problem in construction, including health and safety. And that included a lot of other things, though, as well, around contracting, risk management. And that construction sector accord was essentially a group of senior leaders from construction engaging with the government. And there were 4 government ministers involved. So it was a great vehicle for us to get some stuff done. And then, of course, when COVID-19 came along, it became a great vehicle for us to talk to government about what we needed to do to actually keep operating. So we already had a really good channel through government, primarily through MB, to actually work through what we wanted to do. So as Stacy said, 3 to 4 weeks ago, we could sort of see the situation emerging where we'd probably need to have a pretty good story with government about how we could safely operate post a level 4 lockdown. And look, New Zealand's in a pretty unique situation as well, because our government's approach to dealing with this crisis is unique. I mean, we've got an elimination focus at the moment, which is different than Australia. It's different than the UK. It's different than a lot of other places around the world. So we've got to recognise that and probably adjust our approach with the government as well. So it certainly probably wasn't as difficult, certainly wasn't as easy, perhaps as some of the places like the UK or Australia comparably. So look, what we decided to do around about 4 weeks ago is say to the government, look, let's us pitch to you how we believe that we can operate, rather than the government dictate totally how our sector is going to work. And you can sort of see the difference that we've taken compared to, say, education. I still feel sorry for our teachers and other people at the moment who have basically been given a bit of a fait accompli, and across other sectors at the moment as well. I know they're sort of scrambling to get their act together. So in some ways it's been good for construction that we've been sort of proactive, and as Stacy said, there's been a lot of people that have got us to this point where we believe we've actually got a good message for government, and also a good message to our workers, which is really important, because we do know that getting workers to come to work is also really important. They've got to feel safe. They've got to feel confident that when they go to work, they're not going to be putting themselves in danger, or their families, or New Zealand society as a whole. So look, what we thought we'd do is we've actually got a framework, as I'm calling it, overall. And at the top of that framework is a standard. And if you go onto the Chasn's COVID-19 site, you can see that standard. And that standard's a high-level document which basically talks about the principles of what must be achieved under a safe construction operation. So it doesn't go into the detail about how you achieve it. That's where the protocols come in. So we believe that the standard, it's not a New Zealand standards, as in terms of the New Zealand ANZ standards. It's an industry standard. So, if anyone knows anything about standards in New Zealand, they take about 6 months to a year to get through. So, of course, it's not a standard, but it is being recognised and endorsed by WorkSafe as an industry standard. So that's really important. We have that endorsement. So the standard really talks about really 5 sort of phases at a high level, which is then followed up by the protocol all the protocols as well. So we talk about look what businesses must do before work, before people go to work, which includes a lot of planning. And we talk about coming to work or coming to the site or the location of the work. We talk about what happens during the day. We talk about the end of the day, workers going home, and then we talk about what to do if you actually find an issue as well. So again, the standard sits at the top. We don't expect the standard's going to change, and it is industry-wide, so it covers all types of construction, including residential. Then what we found was, look, underneath that, the protocols, which Stacey's going to go through more in detail for the rest of this webinar, talk about how the standard might actually be achieved. So the protocols themselves are there for your guidance, for your application on first of all horizontal and vertical sites. There is also another protocol on the Chesn's website for residential. So there was a similar residential team that actually worked on theirs, which is probably within the context of a much smaller business that doesn't have the resources and capabilities that some of the larger businesses does. So there's both documents are available on the Chesn's website. They're both worth a read because I think the third level, the business plans and the site plans, which you're all going to be required to have some form of, you're going to need to actually take these things into account and work out how to do this stuff on your own sites in a very practical way. So it's very hard to sit in the middle and work out exactly how things are going to work on a daily basis because, you know, we're not out there, we're just sitting in the middle talking about the principles. It is really important, though, that the principles are taken into account and that the protocols are read for your own guidance. And then when there's something not covered in the protocol or there's a question of application, or we need to go back to the standard and actually look at what the standard asks you to achieve. So that's the relationship between the documents. We have the standard saying the what, the protocol saying the how, and then down to business and site plans. One thing that the Prime Minister mentioned last Thursday at a 1 o'clock session was she was talking about look, you know, we need all businesses to be able to come into line and essentially in some place in the future be able to, she'd used the word, I think, self-certification and auditing. I don't think we are going to be in a situation where businesses will be audited. However, I do believe we're in a situation where all businesses operating under construction are expected to actually have a good plan in place for COVID-19, and that plan should be communicated and worked through with the employees as per the Health and Safety Act 2015. So all those stipulations are there, and potentially WorkSafe would use the standard combined with the protocols as the test of what's reasonably practicable for a business if it ever did come to court. So there is a little bit of teeth in the background with this thing. So we have that acceptance from WorkSafe. The final thing I'll say is all things change. Although I said the standard is likely to remain pretty much as it is, the protocols and how we deal with COVID-19 and the operating environment will of course change. So we're expecting that. We're expecting that because how we're dealing with this virus nationally and internationally is changing on a weekly basis at the moment. It's also will change because as we learn more and get feedback from the field, from you all, around how things work or how things don't work, we're going to need to update the protocols as well. So the most current and up-to-date version of the protocol will hold in one place, which will be the Chesn's website. We'll make sure that it is the changes are tracked throughout the document so you can see what the changes are. So look, my advice is to keep an eye on it on a weekly basis, and probably towards the end of the week there may be probably we'll have a new version come out. I'm talking about next week or the week after, and as things are updated and as we get feedback from the field, we also want to share people's experiences and create an area for sort of common tools, good ideas, bad ideas, that haven't worked, advice, and we're going to create that in a resources area as well. The last thing, on the COVID-19 Chasms page, there's a number of info lines and 0800 numbers, depending on which part of the business you're in. So they're there to actually provide a resource for you for interpretation, for questions. I think Stacey's had a few calls already. We're not. We're sort of expecting that there will be a few clarifications needed, and I think the whole industry is ready to sort of come together and support each other at the moment to find out the best way of doing this. So look, Stacey, I'll finish there and hand back to yourself, and then we can cover off any questions as they come up.
Thanks, Chris. Yeah, just probably to your point there around updating of the protocols. Yeah, I mentioned before, and Chris just mentioned, they are a pretty live document. As we go through, we're going to find little things that are wrong. I picked up a couple of errors this morning, but there's going to be some fundamental changes as we go through, as the government changes its messaging. So we have as part of your registration, we have all your email addresses, so we'll be able to push out and provide notifications as and when protocols are updated. And also we'll just be going through our normal distribution networks. So I suppose already from some of the feedback we've had, it's around, it seems a bit too difficult to implement this. I think some of the pack houses and the fruit kind of industry has been operating at a level 4 protocols, and those guys have managed to make it work in a couple of days. So we are engineers and contractors that build stuff. So it's, I suppose, implementing these is only probably limited a little bit by your imagination. It's a matter of working through it and working out what you need to put in place to make them work. We've taken it that most have read through the protocol, so you're pretty aware of the detail that it does contain. We'll just start at the start here, just around before arriving to site. One of the key things that needs to be done is induction for your workers, and specifically around what these protocols require them to do. But also some clients will require that critical risk induction is redone. So you'll need to be working with your clients around inductions and what they should contain. We've had discussions with the NZTA. The break that we've had here for most has been greater than the Christmas break period, which is generally 2 weeks or so. We've had 4 weeks break here, so there will be that reinduction into site, and that needs to be part of the plan that you put together and that you agree with your client. I suppose one thing to stress, it won't be when we go to level 3, it won't be everybody just goes back to work. You'll need to be working through site-specific safety plans, and including these protocols in them, and making sure that you're agreeing them with your client. You need to have that signed off and make sure that process is robust. For sort of the medium and larger projects, our guidance at this stage is that most of the work and the ramp up as we go back into work will focus around critical path activities, and also those activities that do support the critical path. So again, you'll need to agree with your client what constitutes critical path, and it will be different for different sites. I suppose one of the key things also is around the supply chain, making sure that your supply chain, especially around deliveries, is aware of what your needs will be, and therefore they can provide. So there is some guidance on the Memby website around what is essential services, and that does relate to supply chain. So you need to make an assessment of what that needs to look like, and how you go about contacting and making sure your supply chain does have the right equipment, and I suppose the product, if you do need to source that.
Hey, Stacy, just jump in here, mate. The other thing I think, just reinforcing, you mentioned before that, we have been on furlough, for 4 weeks, many of us, and one of the requirements of the standard as well is that, before you start again, just make sure your site's fit for purpose, like all your equipment's fit for purpose, that your scaffolding's up to spec, that things haven't happened during that furlough that create other dangers, because it's all very well to think about COVID, but you know, we still have falls from heights and all those other things that sort of happen every day as well, if we're not careful. So we don't want to drop our guard around and just charge into a site and just assume it was as we left it.
Yep, good call. Around a site-specific plan, we need to get that right. We need to get it in place and agreed before people go back. So for the front half of this week, that should be a key part of where you provide resource. The three key issues that should be covered in the plan is good hygiene. We'll chat about what good hygiene looks like. The contact tracing. This is a key part of the government's messaging recently, and it's something that there are some apps that have been developed. I haven't seen anything personally that's on the market that we can push out to you guys to have, but it's something that I know that a few of the companies are working on, and once something does come out, then it will let you know, and then it becomes your decision whether you want to keep with maybe a paper system or have something that's an app or smartphone based. And the other one we'll discuss is the distancing. So there's already been a fair number of amount of discussion around the 2 metre rule, which has been widely communicated so far from the government. But those that listened to the government on last week, they mentioned 1 metre. So we'll address that a little bit later on. This is not business as usual. You've got your other PCBU requirements. So this is your requirements under the Health and Safety at Work Act. So you need to make sure that you're covering them off as well. And as I mentioned, it won't be just a rush back to work. So as Chris mentioned, there was Jacinda mentioned self-registration scheme. So we'll see what that looks like during the week. We probably should get some more information this afternoon when they let us know when they are going to go back to level 3. So one of the questions that we've had through the process is around who's paying. That's with the government subsidies and the wage subsidies that have been pushed out. That's helped some businesses. About 10 days ago, there was government procurement guidance that was issued, and that we'll send a link following this around what that does contain. The three key areas that in relation to our membership is around suspension and variation. So that's around 3910 contracts, and that talks around that the contractor will be entitled to a variation. But as I mentioned, we'll send you the link, and then you can discuss that internally. It mentions cash flow. So looking at different mechanisms that clients have around providing cash flow. And then thirdly, it talks around hardship and what that looks like, and what relief can be given to contractors that have been affected. So we'll send those guidelines out if you haven't seen them already. It'd be well worth your time to go through, just to make sure that you are aware of the current changes to laws and regulation around COVID-19. Good hygiene practices. So that is one of the key messaging from government as we go forward. As part of the process of developing the protocols, we talked to an epidemiologist at Auckland University, and their key messaging around hygiene is washing hands, making sure that you're washing your hands to 20 seconds, the soap, but also as part of that, part of their advice is actually drying of their hands. That's also a key part of the whole process. Sanitizers, if you've got access to sanitizers, then they should be it should be used as well. And also just the washing down of surfaces. So mess canteens, frequent touch points like light switches, maybe making sure that they're frequently washed down, especially at the end of shift. There was some discussion around laundry. So when people do go home and they have their work clothes, there was guidance that 60 degrees wash temperature was required. the messaging from the epidemiologist was that just at normal wash temperature is okay. The important thing is to include detergent and soap, and that line drying is better than machine drying. So where possible, and that's accessible to sunlight, so UV light. Discussion around smoking and vaping. There is a possibility there for the virus to attach itself to smoke particles. So the early evidence is that exhaled smoke will carry more virus than exhaled vape. The low voltage vapes make much less smoke, but breathing the smoke or the vape in is probably not the best idea. So hence that needs to be a controlled activity, and it needs to have a designated area where that activity can take place, and there probably needs to be staggered as well, so that there isn't any form of contact or that may pass the virus on. Around the distancing, so 2 metre versus 1 metre distancing. So PCBUs need to demonstrate they have a controlled environment. This is some of the messaging that Jacinda had on last week around the 1 metre, that it needs to be in a controlled environment. I think under the Act, anybody working within 1 metre does need to have that controlled environment, and there'd be also to demonstrate that they have adequate controls in place. I suppose the last thing that we want as an industry is to have a cluster that is focused around a work site. So therefore, that the 2 metre distancing is something that we would advocate. I suppose, Chris, you've had a bit more to do with 2 metre, 1 metre discussion.
Yeah. So look, cards on the table, everyone. When Jacinda suddenly talked about 1 metre on Thursday, it was a bit of a surprise. I think to everybody working on this. We talked to MD and Health afterwards, and I think their response is, look, the World Health Organization has just recently changed their advice down to 1 metre. So if you go to WHO, and I went immediately and checked it, and it's true. So last week they also changed their advice down to 1 metre. From what the explanation was that I received from government was that 2 metres is appropriate in a public space where you can't actually contact trace. So if you're going to a supermarket and you've got customers wandering up and down, they're saying, look, 2 metres, or in public, 2 metres is all appropriate, because there's no way you can contact trace through that situation. In the workplace or at school, because you also know that schools have gone back, you can contact trace. So they've actually dropped the requirement because of that, to say, hey, look, they understand that 2 metres in some situations in the workplace in particular is impossible to actually achieve the work. The approach that we've come back with, and I think it's quite a good approach, and this is an approach that the unions also support, is that, hey, it's 2 metres where possible. So if you can rearrange your work, do all the things in the protocol to achieve 2 metres, you should. If you do have to go down to 1 metre for some specific tasks, then let's just use our hierarchy of controls as we would in any other risk situation to make sure that people are protected, because we still don't want them to get the virus, right? Even if we can track and trace them. So, if they are working, 3 guys on a piece of jib board, or they're doing a crane lift, or the 2 people up a cherry picker, just think about sort of minimising that kind of operation if we can. If we can't minimise it, then, or segregate the people properly, then maybe that is a case where a little bit more PPE comes into place. So if there is someone who's potentially symptomatic, they don't actually spread droplets to somebody else who were in close contact with them, that will then pick up the virus. So I think the pragmatic approach at the moment is look, we should all strive to attain 2 metres where possible for the protection of our workers, and workers will want to hear this story, because we can't just suddenly say, hey, look, for the last 4 weeks we've all been telling us it's 2 metres, and all of a sudden you come to work and it's 1 metre. It's a bit of a strange response. I think the right way of doing it is, look, it is 2 metres still wherever possible, but if you have to work in close proximity to each other, think about that hierarchy of controls that we can put in to actually minimise any possibility of the virus transmitting.
Thanks, Chris. I suppose that leads into the discussion about the role of PPE. You know, anything less than 2 meters, you will need to have PPE on. You know, it needs to form part of your controls. You know, there's a lot of discussion around access to PPE at the moment, and having essential workers and those in the healthcare system do have priority in that space. So staying outside the 2 meters lessens the requirement for PPE. I suppose masks, the useful effect, people's awareness around them touching their face. You know, this is the advice from we've had from the epidemiologist. But they need to be aware that other risks of masks, like touching face, fogging of safety glasses, can introduce other risk. Also, once they're damp, you need to wash your hands every time, and they need to be disposed of adequately. I suppose people would have noticed in the FAQs that thermometers, there's been a robust discussion around thermometers and their place. Some sites are chosen to implement thermometers to monitor workers coming into work, but it's not going to be applied across the construction industry. Purely from making it happen point of view, there's probably not enough thermometers out there of the gun type that meet the required standards. So we're going to have a bit of a fail if we try to implement that. And
I think the other thing, Stacy, there is you do need a certain amount of expertise to actually diagnose people. And we also know that people can present with COVID without having a temperature. So we don't want people to relax on the hygiene and the hand washing, which is actually the #1 control in all this, which has been backed up by the epidemiologists at Auckland University.
Yep. Vulnerable workers. So the ministry has issued some guidance. We can forward on the link to that guidance as well. So if you have vulnerable workers, you're going to have to not have them come to the work site. So the key ones are workers with respiratory disease, so lung disease or severe asthma, serious heart conditions, immunocompromised conditions. One that was a bit of a surprise is severe obesity. So have a body mass index, so BMI of 40 or higher. So if you've got workers with a BMI greater than 40, you're going to have a discussion about how they transition back into the workplace. Diabetes, chronic kidney disease, people undergoing dialysis and liver disease. But we'll provide that link so that people can check to see if their workers possibly vulnerable. I suppose we mentioned contact tracing. At this stage, we don't. A paper system is probably the simplest way of making sure that workers, when they are coming into contact with other workers, they can record who they are, and these all need to be provided to government if we do have an outbreak at a site or within the industry. So you need to make sure that you've got some robust system for accurate recording who the workers have come in contact with and being able to make that available. I suppose as part of the normal site-specific safety plan, you need to have a specific emergency response plan. If you do have an emergency, it's not going to be business as usual. When the emergency services do turn up, there'll be distancing, there'll be all the things that we've discussed today, and you will need to make sure that your site-specific emergency response plan details what is required. So yeah, a fair bit of thought needs to go into that.
I think the other thing to say, Stacy, just to clarify, is that each site will require its own COVID-19 plan. So we know that some businesses have got multiple sites, so we do need them to be site specific. I guess the clue's in the name. And if people are working at a remote location, we do need to have some kind of plan around how they're working on that remote location as well. And I do know that WorkSafe will be randomly auditing those sites, looking for their plan.
I suppose that's a good point there, Chris. Enforcement of these, the standard and the protocols.
Yeah. So look, just like any, there's no changes to the Health and Safety at Work Act 2015. So WorkSafe already have regulatory powers to enforce any kind of risk to harm for individuals. It's in the Act. This piece of work, particularly the standard, will be used as a reference point for what is reasonably practicable that organisations should be doing.
So level 2, we're beginning the discussion around level 2 and what the protocols look like for that. General messaging from government at the moment is they won't be too dissimilar to what we're seeing in level 3. So I mean, if we can make level 3, but we should be able to definitely make level 2 work. So once we get a bit more advanced in level 3 and government gives an indication of what level 2 will look like, we'll start to push them out as well. And again, they'll be distributed and put up on the Chazan's website. So that generally concludes the briefing we've got here, and we are running short on time now. We've had several questions come in prior to today. So we'll just run through them. Inter-regional travel. Oh, sorry.
Yeah. I guess, look, again, this is slightly outside the protocols. This is more in the level 3 table that the government put out. I do know there has been some precedent under level 4 for teams actually travelling interregionally for work. However, that was under a very strict set of circumstances. So basically, I know that there were some teams working on essential construction during level 4 that had to sort of self-isolate in their own sort of bubble within the construction site for 2 weeks before they were allowed to mix with the rest of the construction site. So that's something where I think we need more clarification at the moment about how that's going to work. We don't know. There has been some precedence for it to happen though. So look, we're hoping to get that sort of clarification in the next sort of week or so.
Yeah, we approached NZTA, or CCNZ approached NZTA on Friday afternoon to discuss interregional travel and how they saw it. They were still seeking a position from government. So once they have that, we will we'll, update our protocols with what their position is on that.
There's one there, Stacy, about essential, like quite a few questions about vulnerable workers. I think here we just defer to the Ministry of Health and their definition. So there's no specific definition for construction of a vulnerable worker. It's basically whatever the Ministry of Health define that as at the moment under their definitions under their COVID-19 page.
Yeah. We've also had some questions around winter works. There has been some discussion about clients looking to get budgets completed as we move into winter. I suppose the key thing for our membership is around that agreement on quality and what that will look like. We've had a bit of a dry summer. Some of those earthworks may be able to be continued. Well, dry summer up north here, not so much down south. So there may need to be additional budget allowed for fill drying, for pavements, maybe foam bitumen or cement stabilisation, so that we can achieve some quality or achieve quality in some of those outcomes. Otherwise, we've got to set ourselves up for a bit of failure there. So that's the questions we have at the moment. Fraser, have you received any during the webinar?
Yep, lots coming through. Some really interesting ones there, and I guess key is for everyone. We can see the questions that have come through the chat, and any that we haven't answered in this webinar, we will look to address and follow up. I thought, an interesting one was around outside of work hours. Did you see that one come through, Stacy?
No, what's the question?
So how does one ensure workers are following protocols outside of work hours, and what steps are reasonable for a company to take to address that?
Yeah, it's along the lines of the government messaging around your bubble and staying within your bubble. Under level 3, they are talking around if you've got people or vulnerable people that you can extend your bubble. And I suppose it's as an employer, you can have some contact tracing with your employees outside of the workplace. You need to reach agreement with them that they are recording all those contacts.
Yeah,
a couple more. Sorry, go ahead, Chris.
I think at the end of the day, like, we're all subject to the wider restrictions that government are running at the moment. So as a private individual at home, we're still all subject to that. I mean, what we're just being presented with now is a new set of requirements while we're working.
Yeah, another interesting one was around, there was a point someone made about potentially flushing all zips and kettles and shared equipment like that. Any thoughts on that, guys?
I do know that probably not so much on construction sites, but in other areas, people are concerned with, HVAC systems that have been sitting there dormant for 4 weeks, probably the old style ones with, the water in them, that we don't end up, with bloody Legionnaires all over New Zealand because people haven't actually gone in and done the checking that they should before the building's been sort of reinvigorated. So I think that all that sort of just good practical stuff to sort of say, well, what are the other health risks that we might be introducing? It's no good if we give the whole site Campylobacter or something like that. But hey, we haven't given them COVID-19.
So another question was around the definition of an active construction site, whether it was where construction had started before lockdown or whether it included projects where procurement was completed and ready to construct.
I think the only difference at the moment would be for an active construction site is to do those pre-start checks that make sure your site's still fit for purpose. That's the only. I guess, Stacy, any views?
I think you need to be talking to your client. There needs to be that two-way communication about how you are going to go back to work, and getting a definition or a position from them is a key part of this whole process.
Yeah, great. So we've gone through a few questions there, and I think it's important that we address concerns and feedback that the industry has. So we'll look to do that. We'll send out a quick survey link. It won't be a hardcore survey. It's more around an opportunity for people to ask questions. So it's going to come out in an automated email after this webinar, and we will also be able to send through a webinar recording link as well, so that people can get access to that. So I think our intention was to run this for about 45 minutes, so pretty much bang on time at the moment. Any other people that want to ask questions via the chat tab, please feel free to do so. We did have one other thing, which is around reinforcing that government requires the site-specific plans as opposed to like general workplace plans for COVID-19. So yeah, that was one other thing that people want to be reinforced. So that's one. Anything else to add to round off the webinar, Chris and Stacy?
Oh no, I suppose we'll find out this afternoon what the landscape's going to look like. I think doing that proper planning prior to going back is going to be key to make sure that the whole industry does it right and does it properly. The last thing we want is to not do it properly, and it has to be put under scrutiny. So as Chris mentioned, the education sector got a bit of a raw deal the other day. We're sitting fairly good to start ramping things up. So let's just get it right.
Okay, great. And just to round off, everyone, sorry the slides were a bit hazy there. So we really just intended to show people the protocols themselves, but they're readily available at www.chassins.org/COVID-19. So there you can find the standards document, the vertical and horizontal protocols, and the residential construction protocols, and further tools and resources around how to implement these protocols on your work sites. So that'll be updated as things go on. Lastly, on behalf of CCNZ and Construction Health and Safety New Zealand, I'd like to thank you all for attending this webinar. Everyone's looking forward to get back to work. I know we're all waiting for the announcement later today about when that might be, but thanks everyone for coming along, and thanks Stacy and Chris for taking the time to present to us.
No problem. Cheers, Fraser.
Okay. Thanks, guys.
Signing up.